Thank you, Dr. Tedros, for showing us the way to make human rights a reality in global health. Introducing the flow of our discussions today, the field of health and human rights, as we've said earlier, seeks to employ human rights under international law to advance the public's health. With this textbook on foundations of global health and human rights, seeking to look across the field to support the next generation of scholarship and advocacy. Those of us in this interdisciplinary field bear witness to the ways in which international human rights standards can influence policies, programs, and practices to bring meaningful change to people's lives, elevating health concerns of domestic and global policies, integrating legal norms in public health practice, and facilitating accountability for realizing the highest attainable standard of health. Yet to realize health and human rights into the future, it would be necessary, as Larry said, to accelerate health and human rights education. Drawing from the growing literature in the field, we set out to create a book that could provide a foundation for education in health and human rights, with chapters developed with an explicit educational purpose, case studies to clarify important principles, and questions throughout the book for student consideration. As Larry and I began to plan for this educational text, it became clear that the growing field of health and human rights had fostered a generation of thought leaders. And I'm so inspired that we were able to bring together the collective knowledge of 38 scholars, practitioners, and advocates throughout the field, drawing on their expertise to shape the development, the implementation, and the application of human rights in global health, and to provide this knowledge as a foundation for the next generation of the field. Bringing together these contributions, our textbook on foundations of global health and human rights is organized in 4 main sections, seen here. In the opening section, we seek to provide students of the field with an understanding of the development of human rights norms and principles that frame global health, introducing the right to health and the wide range of human rights that underlie the public's health. Beyond the development of human rights under international law, Section 2 frames the implementation of human rights in health policy and public health practice, seeking to understand how international human rights law is translated into meaningful change in individual lives. With this understanding of the development and the implementation of human rights in global health, we look across 10 chapters in sections 3 and 4 to examine the application of human rights to contemporary public health threats and to analyze the rising human rights challenges in a globalizing world, exploring the collection of core global health topics that we'll be discussing today. Yes, this volume addresses a range of varied topics at the intersection of global health and human rights, but it's intended to be read as a single educational text, with each chapter designed to build from the one before it, while adding new information to the reader's understanding of the field. This book is a journey to understand the field of health and human rights, and we begin that journey today.